Why do you want this job?
So I want this job because I feel like I'm competent and I'm knowledgeable to handle the responsibilities and treatment of patients in this population. And it's always just been like a personal passion of mine to work with the geriatric population and like rehabilitate them because I've personally seen the impact that speech therapists have in their lives, both personally and professionally.
Good. And what attracted you to this company?
Well, I was attracted to this company. The first thing that caught my eye, anyways, was that you guys have a newer facility. So you guys have a lot of upgrades that would be really good for the patients, especially in receiving direct care. I used to work in direct care in a rehab facility that wasn't necessarily like newer. So I think you guys having those amenities for the patients is great. And I also really like that you guys have a full rehab team here. It's just amazing that I would be able to have the opportunity to work alongside with other therapists that have like the similar mindset of me with rehabilitating these patients.
Good. What is your greatest failure and what did you learn from it?
Oh, that's a good question. Well, I mean, I don't really like the word failure. I prefer to like look at failures like more as kind of setbacks or like letdowns. I've learned that failure isn't necessarily a bad thing. It's a time for me to just learn and grow as an individual. But to answer your question, I would say that a moment of failure for me was it was actually in undergrad. I was a college athlete. And after my first year, I got cut from the team. So it was really hard for me. And like, I remember looking at myself as a failure, like during that moment. And then my whole like academic path changed and I had to relocate universities. And it was a very changing moment and like pivotal moment in my academic journey. But now that I'm like looking back on it, I'm like, that wasn't a failure for me. Like that was a time for me to grow as a person. And it was just a setback and it was an opportunity for something better in life to happen.
Good. What kind of salary are you seeking right now?
I'd say I'm definitely seeking like a competitive salary for what a speech therapist makes in this area, especially due to the cost of living. But I mean, I am understanding in the fact that it would be my CF. So I would still be under the supervision of an SOP and I wouldn't be getting that salary that an SOP with their Cs would be getting. But I noticed that on the application it said that the salary offered was 60,000. So I think that's pretty good and it's competitive. But I would also ask you guys about maybe like benefits or like some financial reimbursement for relocating because I would be relocating to this area.
Okay. There's a question at. Why do you think that this amount is appropriate?
Well, I think it's appropriate because, I mean, like I said, I wouldn't be fully licensed with my Cs yet. I'd still be under the supervision of another SLP here. So I definitely understand that I wouldn't be getting paid as much as her or anyone else, but I still would like that type of salary base, especially the relocation.
Okay. What are you looking for in terms of career development?
So for career development, I'm mainly looking for opportunities to just continue to further my knowledge in the speech and language field because it's forever evolving. So I would look into like CEUs that would pertain specifically to my patient caseload at the facility and see if you guys offer like, hey, like we offer this amount of CEU money for you to spend, then I would make sure that I use that money like in the best way that would benefit the patients at the facility.
Okay. If I were to ask your last supervisor to provide you additional exposure, what would she suggest?
So my last supervisor actually was with a birth to 3 placement, so it wasn't with a skilled nursing facility. But my birth to 3 supervisor would probably tell me that I needed like additional training and exposure to feeding patients, more specifically like infants, because we only had a few on our caseload, not a ton. So I definitely would benefit from more experience in that. But as for my last supervisor at my SNF placement, kind of similar. I would benefit from training and exposure with swallow studies like MBS and FEES, because we didn't perform any. We did see some, but personally, we weren't involved in that part of like the treatment.
Okay. How would you go about establishing your credibility with our team?
I would establish credibility just by working closely with my supervising SLP and like making that professional relationship with her, so that other people can see that I'm trying to work with her to still gain that knowledge from someone who has their C's. And also, I would just make sure that my reactions and my actions with patients reflect my knowledge and experience that I did get in graduate school. But I'm not the type of person to like show off my credibility and like, oh, I graduated from this university and I have this many hours with this type of patient and that type of thing. I really just try to hold myself to a high standard, be humble, and like have a good attitude and professional.
Okay. What do you see yourself doing within the first month of this job?
Within the first month, I would definitely try to build a foundation of professional relationships with my supervisor and with other therapists there, the nurses, just all of the employees here. I would really strive to build that foundation. And I would also just strive to get myself like into a routine here and a routine with my caseload, so that my patients are getting the best treatment plans and the most ethical treatment.
Okay. What techniques and tools do you use to keep yourself organized?
Oh, wow. Well, I am very organized, not to sound OCD or anything like that, but I'm super organized. Even though I'm a millennial, I guess, I still keep that physical, like hard copy planner on me, and I write things down in it. I keep up with my days in it. And of course, I use my phone calendar too. So things like that I use, but as for documentation, I'm proficient in all of the Microsoft Windows with Word, PowerPoint, Excel, all of those things. And even with my previous placements, I've learned different documentation platforms for Medicare and Medicaid.
Okay. Tell me about your proudest achievement.
I'd say my proudest achievement was probably graduating grad school with my master's, mainly because I was the first person like, so it wasn't just like an achieving moment for like myself, but I got to like share that moment with my family. So it was really awesome. And I still look back on it and I'm like, wow, I'm so thankful that I made it this far.
Last questions. What is the most important thing you learned in school?
Another good question. Well, I learned just so much in school, not just like coursework and practicum, but like I learned a lot about myself. But I'd say the most important thing that I learned was to celebrate the good moments, like even if they're small, tiny victories. like celebrate those and to not dwell in the bad moments personally, and like even for my patients, like if a patient that's diagnosed with dementia, I walk into the room and they remember my face and my name, like to other people, like that's like no big deal, but that's a small victory and like that's worth celebrating, you know? But also vice versa. If they didn't remember my face and they didn't remember my name, it may be a bad moment for them, but it's a moment for us to just continue working on those strategies to remember familiar people. So I did learn a lot through coursework and practicum, but I also learned a lot about myself and kind of how to handle different moments.
Okay. That's it.
Thank you so much.
Thank you.